When you think of the front lines of the pandemic, doctors and nurses are often the first people to come to mind, but there are others. Caroline Corrigan shows us how chaplains are needed now more than ever.
Most hospitals have strict visitor restrictions in place for people battling COVID-19. Patients are only allowed to have direct contact with doctors, nurses, and if they want, chaplains. Greg Daniel is one of 7 chaplains on staff for the Erlanger health system. He says the patients he visits do not see family members unless it's through a video conference call.
It's a struggle for patients and for families because in crisis, families want to be together typically. They want to be in a physical proximity to support and care for their loved ones.
It has changed the way chaplains like Daniel provide spiritual and emotional care for patients and their families.
Of course, we've always cared for families and been with loved ones and the patients and their loved ones in their last moments oftentimes, but this is a little bit different.
More than 60 people in Hamilton County have died from COVID-19 since March, some in local hospitals. Patients from surrounding counties have also lost their battle with COVID-19 while seeking treatment in Chattanooga hospitals. In some of those cases, Daniel has stepped in to be a source of comfort to the patients who would otherwise die alone.
I was on a Zoom call with the family members that couldn't be here and helping them to say goodbye to their mother. And they couldn't be in the room. And so as they talked, the nurse and I, she held one hand and I held the other as they said goodbye to their mom.
A final moment made possible by a complete stranger whose frontline battle is won with comfort and love. Reporting in Chattanooga, Caroline Corrigan, Channel 3 Eyewitness News.